Emergency rooms are struggling to handle a rising number of children and teens showing up in need of mental health care. The crisis has only worsened since the coronavirus pandemic began. 3 medical associations have written a joint policy statement outlining the issue. They said there are, quote, limited resources in the community and on an institutional level to provide optimal care. That has led to ERs becoming critical access points. Dr. Christopher Kang joins us now. He's an emergency doctor in Washington and the president of the American College of Emergency Physicians. Doctor, how significantly has the problem increased since the start of the pandemic?
Thank you so much for the opportunity to speak on this critical issue. Mental and behavioral health issues have been on the rise for more than several decades, but through the COVID pandemic, it has escalated to crisis proportions where the number of patients that we're seeing and the ability to see them and evaluate them and disposition them quickly has been challenged by a lack of resources, both in the community as well as in the healthcare system.
It's a really jarring headline. You also see reports that suicide rates are up nationwide, and especially among young people. And so what should they do? And is the emergency room really the proper place to treat young patients in desperate need of mental health care?
Thank you. Emergency departments will always be ready to be a point of access for any patient that believes that they need the care or that their family members believe need the assistance. However, because of the boarding crisis, because of nursing shortages, because of lack of inpatient beds, emergency departments are also challenged right now with the number of patients coming in and where to be able to transfer them or admit them appropriately. And this is where we're asking for a community-wide response from families to community agencies and services to state and federal governments to all recognize this issue, to identify and call for additional resources so that we can support this next generation.
Because of this lack of resources, is there concern that the standard of treatment people are getting isn't going to be up to par?
I think the standard of care for evaluating and identifying and seeking more assistance and consultants for those who need it is not being challenged. However, the ability to identify where and when these patients need to be admitted, or if they are discharged home, to have the appropriate follow-up care because they will need sustained therapy and counseling is going to be an issue for many years to come.
I'm glad you mentioned sustained therapy and counseling, because all of this seems to be kind of the residue of the pandemic, right? Exhausted nurses, not enough resources. Telehealth is something that's emerged and more programs, healthcare programs will pay for. So what do you advise as the best strategy, not just to get people the resources they need, but to keep it on that long-term track that you say is so important?
Thank you. I think this is a multi-pronged approach. One is to, for us as a community, recognize that this generation is being affected, that they have needs. Second of all, is the healthcare system identifying and better staffing, better resources, and better protocols and additional research. But it also does communities and how we can be more innovative. So whether it's an outreach for family members, whether it's schools and community-based services, including innovations such as telehealth and mobile crisis response teams, and additional community-based cares that can be developed through time through the assistance of state and federal governments.
What role do you think parents, teachers, anyone else who's guiding children can play in helping kids get the mental health care that they need?
Is to acknowledge that these issues are rising, that sometimes it's not just a matter of growing up, that times become more challenging. And so when they recognize whether it's their own child or someone in the community that may be not appropriate and behaving appropriately, having issues or challenges, how and when they can say, if you need assistance, how can I help you? And where can then I forward you or send you to those to get that additional assistance?
I love that you said that, Dr. Kang. It's not just a matter of saying kids grow up, right? They're dealing with social media and a whole onslaught of everyone else's highlight reel, and so it's tough out there for a lot of folks. Thanks for joining us. A great conversation, Dr. Christopher Kang.
Thank you.